author of vaccine is Edward Jenner. He first invented or initiated the vaccination theory for smallpox vaccine. He inoculated the particles from cowpox into his wife and children, and he noted that once when they came across the similar virus, the response to the virus or infection was less severe, and they did not suffer like the typical smallpox infections. That led to the invention of the smallpox vaccine. So by late 1940s, I told you we had smallpox in India by about 1800, I think, 1802. And by 1940s, we had a smallpox infection vaccines for smallpox, tetanus, pertussis, and diphtheria. And in India, the BCG vaccination also came in 1948. And for the mass campaign or national immunization program, BCG was kept only in certain countries where the risk was high. So India was among that. So we started having BCG vaccination from 1947. From 1948, in order to avoid multiple shots to children, they clubbed DPT as diphtheria tetanus into one shot. In 1950s, the new invention was the polio vaccine, and we had both IPV in that century itself, IPV and OPV, and it was licensed in 1955. Late 1960s, apart from our smallpox, diphtheria, TT, pertussis, whatever I mentioned, MMR was added for measles, mumps and rubella, and they are live vaccines. And the last three, they combined similar to DPT, they made MMR together in 1971. In 1970s, there was no new vaccine in that century, but we were happy that we completely eradicated smallpox vaccine in 1972. Between 1985 and 94, Haemophilus influenza is something which we all need to know, because this bacteria was causing significant otitis media, epiglottitis, and meningitis. So hence this vaccine was licensed and placed on schedule in 1989. Hepatitis B was also licensed in 1981 itself, but only to the high-risk groups like hepatitis B positive mothers, healthcare workers, IV drug abusers, and people with multiple sexual partners. But unfortunately, this did not bring down the number of hepatitis B positive patients. Hence, it was placed in the National Immunization Program in 1995. So in 1994-95, apart from DPT, MMR, BCG, OPV, HIP, we added hepatitis B also. Between 1995 and 2010, newer vaccines were introduced. The chickenpox vaccine, rotavirus, hepatitis A, and the revolutionary vaccine, pneumococcal vaccine, because pneumococcal vaccine is very notorious to cause significant meningitis and pneumonia, and the bacteria is the streptococcal pneumoniae. And additional recommendations were made during that time for existing vaccines like influenza and hepatitis A. And new versions of existing vaccines were also made. I was telling about DPT, and what we had was the wholesale vaccine. But in 1997, they introduced acellular version. Actually, the wholesale vaccine, which the original DPT vaccine contains, it's meant to be about 78% effective. Whereas the acellular one, which was discovered in 1997, has about 71 to 85% effective. And acellular vaccine, the side effects are very less, whereas with the wholesale, the reports of excessive crying, prolonged crying for 2-3 days, or seizures, hypotonic, hyporesponsive episodes were more obvious. Hence, many countries moved away from the wholesale vaccine and using only acellular. What is the negative side of this acellular is, every time with the DPT vaccine, every year, your effectiveness for the vaccine comes down by about 2 to 10% per year after that DPT vaccine. But if you are using acellular, the decrease is very rapid. That's why whenever we talk to parents, we do explain about both this acellular and then give the option to them. And the wholesale vaccine, which we use in children, is not meant to be used after 7 years of age, because the side effects are more tremendous in older children. And the polio vaccine, as I told you, it got discontinued from 2000 because of, in many countries. In India, we do still use it. In some countries, it's being used. But majority of the countries have moved out of oral polio vaccine because of that wild type 2, which was causing more vaccine-induced paralytic polio. So in 2000, like as I mentioned, all these new vaccines got introduced: varicella, hepatitis A, along with the previous vaccination, and the BCG is missing here. In 2010, we did maybe rotavirus and influenza, not the nasal spray, but the injection form. That seasonal flu was kept in the national schedule. So this is the current 2020 recommended vaccines. So I will tell from the order of birth, so it's easy for you people to remember. So when a baby is born, we do BCG as soon as possible, and BCG is a vaccination for tuberculosis, and it protects mainly from TB, meningitis, and miliary tuberculosis rather than the primary infection. And it is usually given intradermal. Sometimes if you do your BCG vaccination bit deeper, that is, it enters the subcutaneous, then it can cause significant BCG adenitis, or it can cause underlying osteitis also. So you have to be careful when you're doing your BCG. Experienced people should be giving. And as soon as the child is born, especially if it's in a high risk country, you do your BCG vaccine to the baby as soon as possible. And the same time, before the baby leaves, we do the oral polio, that is birth oral polio vaccine, and also hepatitis B. The next vaccine will be at 6 weeks of age. Some countries do 8 weeks, that is 2 months. We do that's diphtheria, tetanus, pertussis, either the whole cell or the acellular one. Along with that, what is clubbed now is the IPV and HIB and hepatitis B. All 6 come in one injection. And apart from that, we have pneumococcal. So at 6 weeks, you do your what are the 6 infections what I mentioned now. And pneumococcal comes separately, Prevnar 13 or PPV 23 strain. And also you will do your rotavirus. Rotavirus is given between 6 weeks, and the latest you could do rotavirus is 7 or 8 months. After that, we don't do rotavirus. Even if the child misses out, the catch-up vaccination can be done only by until 8 months of age. So this is the 6th week vaccine I told. So you give 2 shots to each child, that is DPT, that combination, and the pneumococcal along with rotavirus, which is given orally. The same vaccination we do 6 weeks, 10 weeks, and 14 weeks. Why we do multiple shots? Because if it is a killed one, you need repeated stimulation or antibody protection to give a lifelong immunity. After this one vaccine is over, then 6 months we will introduce our flu shots. If it is seasonal time, flu vaccine is given 2 doses 4 weeks apart, and it's an inactivated vaccine. And the next vaccine is typhoid is typhoid is missed here. Typhoid, you do have oral, which is a live vaccine, or we mainly use in children the injection form, which is the polysaccharide vaccine, conjugate polysaccharide vaccine. So it offers a good immunity, and this now it's kept in the national schedule from 6 months of age. So along with our flu vaccine and typhoid, the next one would be MMR, measles, mumps, and rubella, which we do it at 9 months of age. And after that, we give the first year vaccine, which is hepatitis A. And hepatitis A is again inactivated vaccine, and it is given in 2 shots, that is 6 months interval. So the first one immediately after first birthday, and the second one we do it 6 months later, that is at 18 months. And after that 12th month vaccine, next we do our 15th month vaccine, which includes MMR, that is second booster for that primary vaccine. And chickenpox we do in children after 1 year, and also pneumococcal booster. And then between 16 to 18 months, we do the DPT booster again for them. So, and then again 18 months, there will be a second booster, as I mentioned, for hepatitis A. And by their 2 years old, they would have had 4 shots of pneumococcal, And diphtheria, the DPT complex, again, they would have had 4, and they would have had hepatitis A 2 shots, and rotavirus 3 shots, chicken pox 1 shot. Yeah, and influenza, if they are a high risk or if the parents are willing or if it's a seasonal type, then they get 2 shots and it's every year.